We are committed to creating a safe and supportive space for our guests and listeners, and to provide information and tools that will help our listeners understand, manage, and overcome trauma. We understand that the healing journey can bring up challenging emotions. Therefore, we want to warn our audience that certain episodes may contain discussions or stories that could be triggering for some individuals. The content of the podcast is for educational and informative purposes only, and we encourage you to practice self-care and discretion while listening, and to reach out to a trusted support system or professional if you feel overwhelmed and need help on your healing journey.
Welcome to Healing and Growing Hand in Hand podcast. I'm your host, Lisa Tickle, and our guest today is Dr. Susan Spicer. And I'll tell you a little about her. I found her actually on TikTok, and she does some really great videos. I was just saying, really great videos talking about trauma and all that happens with trauma. And I just found them really helpful. So let me tell you a little about her because she's very impressive. So she is a licensed psychologist, neuropsychological expert, certified brain health coach, and trauma therapist specializing in EMDR therapy, which I told you I've taken EMDR myself and have found it extremely helpful. And I don't usually read a bio, but I wanted to really just do a little snapshot of her bio. And it says, Dr. Spicer has spent decades studying the manner in which brainwave patterns impact our thoughts, feelings, and behavior. And she has extensive experience helping individuals achieve peak performance by optimizing their brain functioning. Dr. Spicer specializes in forensic neuropsychology, EMDR therapy, trauma therapy, clinical hypnosis, and research based on many areas of the brain structure and the brain function. And super impressive. So I have a lot of questions about that, but mostly what we're going to talk about today, and I love this. I know this is going to help me, and this is going to definitely help our listeners, but it's the 4-step approach to healing trauma and narcissistic abuse.
Mm-hmm. Yes.
So tell us more about you that I haven't already said. What made you get into this area?
Yes, thank you so much for that really great introduction. And yeah, I have also worked for a decade in forensic neuropsychology. So I worked in the prison system and did forensic neuropsychological evaluations of inmates and alleged criminals, and then went to court to testify about my findings. So I spent, yes, I've even been to death row. So
I would, we could have a whole conversation on that because that's an area. So there's 3 pillars to my podcast. One is giving a voice to people to tell their stories. Yes. 2, to bring on experts such as yourself that you can give us resources and information. And then the third is the areas where there is abuse that you wouldn't think of or you don't understand the extent. Right. And one of the things, I was doing research on this, and you can maybe correct me if I'm wrong, but the percentage of people in prison that have childhood trauma or abuse is astronomical.
Absolutely.
I think it was, I don't know what the percentage is exactly. I remember I've seen a couple of different numbers, but I mean like over 80%, right?
Oh, I would think it would be at least 80% or more. Yes. And I had the opportunity to hear their stories. Sometimes these alleged criminals, these inmates have never had the opportunity to sit face to face with someone and hear their entire story. And when you hear the manner in which their upbringing and their family environments and their histories of abuse and trauma may have contributed to their propensity to commit a crime, it's really fascinating. And, a lot of them have mental illness, and a lot of them have personality disorders that contribute to their likelihood to commit a crime. But yes, they have had multiple traumas and instances of abuse by the time they get to that point, most of the time. And that's one of the things that led me to really be fascinated by narcissistic abuse. I myself am a victim of trauma and a victim of narcissistic abuse, so it's personal for me. I have an interesting life story that really led to me to become a trauma therapist. But a lot of people have misconceptions when it comes to narcissism and what narcissistic abuse is, but there's no place where you would see more of narcissism than in the prison system. So
that's interesting.
Yes. So I've seen it from a personal and a professional perspective. And I think that gives me a really unique outlook and a unique perspective when it comes to helping victims understand the manner in which they have been suffering from gaslighting or blame shifting or manipulation or DARVO. And they often don't really recognize, wow, it's not me. I'm a victim here.
Right. Right. I know. And my second marriage, I was in a definite narcissistic, the gaslighting, I didn't realize that that's what it was, but I had done enough healing to realize that there was something really wrong with
Right.
that. And I have several friends who have been in actually much scarier narcissistic relationships than me. I mean, their lives were actually in danger. And, somebody who has not experienced being in a narcissistic relationship has no idea what it's like.
Right.
It's so hard to articulate
Right.
how insidious it is. And people are like, well, just get out. It is not
Right.
that easy.
Oh, it's not.
Even in my situation, I recognized there was something wrong with him, and I knew I was planning on sneaking out of the marriage. I was planning on divorcing
Right.
him, but people just don't understand. You just can't walk away.
Right. And there is such a thing as a trauma bond. It's possible to
Yes.
develop a trauma bond with your abuser. Many people think, oh, that's a bond over shared trauma, but that's not true. It is a neuropsychological pathway that's formed in your brain from a toxic relationship cycle of dopamine and cortisol. The abuser abusing you, then love bombing you, and then abusing you and coming back.
Mm-hmm.
And you can actually become addicted to being in a
Mm-hmm.
relationship with a person where it's really difficult to leave. And then you have an abuser or a narcissist who isolates you from your friends and family, and
Mm-hmm.
it gets much worse.
Yeah, he tried that. He was trying that. He was actually trying to get, which was his biggest mistake ever, was trying to get in between me and my son.
Right.
And he was trying to create a wedge,
Mm-hmm.
and I was not having that.
Right.
That was the final straw. That was the thing that I went, okay, you know what? It's time for me to make plans to get out of this. But I didn't. I'd heard the term narcissist, but I never knew what it was, never looked into it or anything. I just thought it was someone who thought a lot about themselves. That's what I thought it was at the time.
Oh, right.
But after I got out of it and I look back on it, I'm like, oh, I mean, he accused me of the most bizarre
Right.
things. So bizarre.
Right. There's a lot of misconceptions about narcissism, and people often think that just because someone loves themselves or is full of themselves or is grandiose that they're a narcissist, but that's not true. It's really a mental condition. And the narcissist has an inflated sense of their own importance, and they have a deep and excessive need for attention and admiration. They have troubled relationships, and they have a lack of empathy for others. But behind this little mask of extreme confidence lies a really fragile ego and a fragile self-esteem that's vulnerable to the slightest criticism. So they can't accept criticism, and they end up using people and manipulating people and engaging in gaslighting and blame shifting and hoovering and darvo. So narcissistic personality disorder is a personality disorder as defined in the DSM-5, what we use to diagnose and treat individuals. So it's not just that a person is really confident or loves themselves. It's actually a personality disorder.
And there is abuse when you're in a narcissistic, even though for me there wasn't the physical,
Mm-hmm.
but there was the emotional.
Oh, right.
It's just so bizarre.
I often tell patients that it's almost easier if someone were to punch you in the face and leave a bruise, because other people come to your aid and they see the bruise and you can easily identify, see, I was abused. But with narcissism, it's so insidious that often everyone else thinks, oh, this person is wonderful and this person is amazing. What is it about you that you set this person off?
Yeah.
And the person ends up having low self-esteem. They end up having dependence on the abuser. They end up feeling worthless oftentimes and suffering from anxiety and depression. And the number one thing I see people come into therapy with is confusion. Because narcissistic abuse involves gaslighting and makes the victim question their own memory and their own sanity. It leads to a significant amount of confusion and difficulty making decisions.
Oh yeah. When he accused me of one thing that was so bizarre, and I remember thinking, where did that come from? Like it was so out there, and I'm thankful that I had enough healing in me to realize that there was something really seriously wrong. And of course, it showed up as soon as we were married. It didn't show up when we were dating, right? I mean, I look back and I see signs now, like, but it really showed up when we got married. And I just, I just remember being confused. Like, I don't understand. This man loves me, but he's doing this weird stuff that is so hurtful.
Right.
And then I've heard I've heard that a narcissist cannot change. Is that true?
That's a really fascinating question, and different theorists believe different things about that, right? So I always tell people that narcissism takes place on a spectrum. And on one end, you have low levels of narcissistic traits. The person may be self-absorbed or unable to have a lot of empathy, but they can typically learn good communication skills and they can learn to develop empathy. But on the other end of the spectrum, you have someone who meets full criteria for narcissistic personality disorder, and they engage in DARVO, and blame shifting.
And that is, what's that?
DARVO is deny, attack, reverse the victim and offender. It is where a narcissist will deny that something ever happened, even in the face of overwhelming evidence. Say you say to them, okay, here's your phone. I can see on your phone that you're cheating on me. You said to this girl, I love you. You said, thanks for a great time last night. You are cheating on me. I can see it right here. The narcissist might deny that and say, that never happened. You're crazy. And then he'd attack the victim saying, what kind of a person goes through someone's phone? Like, what's wrong with you? You will go through someone's phone. And then they reverse the victim and offender, making you feel like you're the perpetrator and they're the victim, right? That's DARVO. So people on that end of the spectrum, research shows that there is not a high likelihood at all of that person being able to change. And for that person, there are no known therapies that can be successfully utilized to get that person to change. So I actually created a quiz called Can My Narcissist Change? And I have it on one of my sites. It's a free quiz that someone can take to see where their narcissist falls on that spectrum. So does he have mild traits? He or she have mild traits, and can they learn empathy? Or are they on that other end of the spectrum where they're not going to change? And so it kind of rates your narcissist and gives you an idea of, should I work on this relationship or should I find the strength to leave it?
Right. No, that would be awesome. And of course, you've got lots of great tools and stuff that we're going to talk about at the end too, that you can share. That's an awesome one. Everybody, I'm going to be sharing that one a lot, because that's really helpful, because there's so much information out there about narcissism and narcissistics and the behavior, and you're right, they do kind of clump them into just like this is a narcissist, and I get that there's the spectrum,
right? So,
and then I've also heard, and you can help correct this if I'm wrong, that narcissists are created, they're not born.
Okay, that's interesting. That is largely true. That is largely true, right? Research does show that there is a genetic component. There is a genetic component to narcissistic personality disorder. It's not all that common, right? But most personality disorders, whether it's the person being a sociopath or a person having borderline personality disorder, there is a genetic component, even to alcoholism, right? We know that there can be a genetic component. We know that there is a genetic component to narcissism, but most narcissists are created through environment. They're being over-gratified or under-gratified in childhood. And they are most of the time subjected to what we call adverse childhood experiences, or ACEs, right? So being the victim of abuse, being the victim of trauma, right? And then the third known factor in the etiology is a combination, what we call neurobiology, a combination between the brain and behavior. So those three characteristics are kind of what people believe in the field now to be making up narcissistic personality disorder.
Interesting. Yeah. It's not an easy subject, and it's so complicated. Yes. So you've come up with the four-step approach to healing trauma and narcissistic abuse. So tell us about that. I really interested.
Yes, this is something that I've developed after years and years of working with trauma patients and with victims of narcissistic abuse. The first step is that we process out the trauma using EMDR and somatic techniques, right? And I say that because I believe that we can't put coping skills on top of trauma.
Yeah, I agree.
Right. If a person's dysregulated emotionally, we need to regulate that nervous system before we try to put coping skills on top of it. Otherwise, we're going to have a person who's emotionally dysregulated, but knows how to meditate or is really good at visualizing our affirmations, right? So the first,
true.
The first thing we do is we process out trauma. And we do that with EMDR using side-to-side bilateral stimulation. I do that through a video platform. I'm licensed in 37 states, so I see people all over the country. And I use this video platform where these two balls go back and forth across the screen, and you follow them with your eyes and you listen to the tick, tick, tick while processing and walking through the trauma. You dip into the emotion of it. You dip into the negative emotions and the fear and the anger and the anxiety that come up. And then after we do that, and for a number of passes, we go to a safe place and we instill those feelings of safety and peace. So what we do is we dip into the trauma, we feel it, and then we go to a safe place. This technique was designed for Vietnam vets. So it was, so it was designed to help you experience and process the trauma and change the way trauma memories are stored in your body. Because trauma, when it's stored in our body, it comes back as a reaction, not a memory. Right? We might hear the abuser's voice or see a car that looks like the car they drive, or hear a song on the radio, and all of a sudden we get that fight or flight response. So we process out the trauma first. That's the first stage. And we take down the emotional response. I always ask the patient to rate on a scale of 0 to 10. How bad does that feel today? Right. And our goal is to take it from 10 or wherever it may be down to 0. And the second step then is I really help the person instill and recall and remember being in a state of self-love, because I believe that self-love can heal most conditions that we have in this life, right? We all come into this world in a state of self-love, but then we forget. We have parents and teachers and peers and society and social media that tells us that we're not good enough. And we start to think and feel we're not good enough, right? So that second stage involves really learning and remembering that state of self-love, right? And then third, as a neuropsychologist, I help people rewire their brains and condition their thoughts to not go down that dark path every day, thinking about the narcissist or thinking about their trauma, but to really learn to get their hits of dopamine from things in life that are healthy and make them feel good. So rewiring your brain, changing your thoughts, thought conditioning is a way to do that. I always say we want to build a new neural pathway in our brain, kind of like cutting a new path through the forest. And then the fourth step, once we've done those three things, is to connect and co-create with our creator, whatever that may be to the individual, whether it's God or Jesus or the universe, the power, a greater, higher self, right? We want to connect and co-create and make sure that we can purposefully build the life that we want. So those are the 4 stages that I lead people through. And I think that it's so key to really do those steps, because I often see women, in particular, men too, but I see women come into therapy who might be on their 3rd or 4th marriage. They've been married or engaged or with a complete line of narcissists, right? Because they keep repeating the same patterns. And I always say that the universe gives us the same lessons over and over again until we get it. We guess them, right?
Been there.
Yes, haven't we all?
Yeah.
Yes.
Well, and I'll tell you, EMDR, the one thing that did for me, and I don't know if this is normal or not, I just know that this worked for me. So I realized in my therapy that I really needed to talk to the little Lisa. Little Lisa had been through a lot. And then there's teenage Lisa, I recognize. And the abuse for both of them was different.
Right.
Teenage Lisa definitely got the tougher one. But I don't know how it worked and why it worked, but what it did is it gave me the ability to talk to little Lisa, to come alongside her and allow her to finally have a voice towards the abusers.
Right.
And it, of course I did this all in my head, but I imagined, and I let little Lisa say, and I just stood beside her, because it was really interesting, because I was doing that in therapy, and my therapist had said, go ahead and what does little Lisa have to say?
Yeah.
And we were just talking to little Lisa, and I said, she's not going to say anything. She is not going to say anything. She's afraid.
Right.
And the therapist just said, well, why don't you just come alongside her? And I said, okay. So I come alongside, and as soon as I came alongside her, the adult Lisa came along, little Lisa, boom, little Lisa spoke.
Right.
And it was really powerful. And I've done that. And actually for my teenage Lisa, I haven't finished it yet. I need to finish it, but I'm writing a letter to her, and I'm validating.
Love
like
it.
She's telling me, oh, well, do you remember when this happened? And she'd go into great detail and telling me. And then I'd say, yes. And you know what, that wasn't fair or whatever.
Mm-hmm.
And I'm validating her. And
Right.
it's really powerful.
It is. It is. I love it.
But I don't know how EMDR worked, but that for some reason gave me that breakthrough.
Exactly. That's really powerful. Yeah. EMDR has 3 different prongs: past, present, and future. And so what you were doing is fascinating. It is, we can have a present day trigger by what we call a touchstone memory or a feeder memory from childhood. So you might want to go back and meet that 5-year-old you, that 7-year-old you, or that 10-year-old you, and remove them from that situation and tell them that you love them and tell them that they're going to be safe and heal that younger part.
Right.
That's what you were doing.
Right. Mm-hmm. Yeah. And I'm still doing it. And I it's interesting because it's only in the last 3 years that I kind of put my whole life timeline together.
Okay.
From as far back as I can remember. And like, there was so many holes that were not filled in, and it seems like they're all filled in. So I feel like I have a complete picture now, and certainly a better understanding. I also learned a lot about my parents, and I knew about my dad's past, but I had recently learned about my mom's past, and it was pretty horrific, you know,
right.
and yeah, so they both came from abuse. And so it just kind of makes sense that they would pass it down. But yeah, that's been really, really powerful for me, and helping me, you know, it takes away that sting of, because I had the belief, of course, that, you know, I was created to be a punching bag.
Right.
I'm, you know, I don't have any value, you know, and that's what I was seeing. And so what this has done is it's taken that sting out, and it's now, oh, it's not because of me.
Right.
Right. I mean, I became a victim in this, but it wasn't because of all the beliefs that I had about myself back then.
Exactly. Super powerful.
Yeah.
Super powerful.
Very, very powerful. So, you know, I would like to touch a little bit more though on the prison, because that is something I actually have started looking into. And I was shocked, like I said at the beginning of the podcast, when we were talking about the number of prisoners that have been raised in childhood abuse or trauma,
right.
and that they haven't had a voice. And in one of my guests, they told me, and this was really fascinating, and I know it's my experience in working with women healing from trauma, that most, and he was saying women who are sexually abused between the ages of 13 and 17, which I guess is the common age, do not voice or say anything about it for 4 decades.
Right.
Before they finally have a voice and they finally say something. And I know that to be true in, like I said, when I was doing my childhood abuse healing workshop, a lot of the women in the workshop were older and had not ever shared their story. So this is obviously true with the prison population as well, right?
Oh, sure. Absolutely. Absolutely. Right. A large number of victims don't report. And there's many reasons. There's shame. There's fear of not being believed. There's fear of repercussions from the abuser, depending on how close that person is to your family. And if you're going to keep seeing that person, there's, a lack of willingness to step forward and report a perpetrator that might be known to your family. But there are many, many reasons that men and women don't report. It's more common than not.
Right. And I feel like we're really over probably the last 10, 20 years, really learning about trauma. We're really, there's research and we're really starting to learn the depths of trauma and what it does to us.
Exactly.
The fact that it stores in our body,
right.
That it's in our subconscious. And I know, when I realized that was really empowering, because then it made me realize, okay, it's not just me being crazy.
Right.
it really is a response that my body is having, but I also can get myself out of this.
Absolutely. Right.
Because I can have the awareness
Right.
of a trigger.
Right. There is a big move in psychology to address those approaches in the mind-body connection and how trauma is stored in the body. So for decades, we used talk therapy to address trauma. And we now know that that is not as helpful as addressing the trauma as is stored in your body first, right? And so Stephen Porges is one of the top theorists. Bessel van der Kolk, who wrote an amazing book, The Body Keeps the Score. He talks.
I'm reading it.
Yes, it's a great book. It's a great resource. Yeah. Another good one is Francine Shapiro's Getting Past Your Past. That's a book about EMDR and how we can use EMDR to release the way trauma is stored in the body. But there's a big movement towards somatic therapies and somatic shaking, EMDR, somatic healing, somatic experiencing, to really change the way those trauma memories are stored in the brain, because we know that trauma causes changes in the physical structure and function of our brain. In the physical structure and function of our brain, we actually can see the amygdala become increased in size and inflamed, and the hippocampus becomes smaller. The hippocampus is your memory center. Your memory center can become smaller as a result of narcissistic abuse and trauma. And your prefrontal cortex, which is the part of your brain that's responsible for planning and organization and decision making and impulsivity and attention, that can go offline. And you have less neuronal activity there. So you have trauma survivors becoming confused. Like I told you, I am a survivor of trauma. That's why I'm a trauma therapist. I remember calling 911 and the operator said to me, "Ma'am, what is your address?" And I said, "I don't know. I don't think I ever had one." I said that to the 911 operator because I was so traumatized that I couldn't think, did I ever have an address? And if so, what was it? What was it? What was the address, right? So I witnessed a shooting in the home, and the 911 operator said, look away from the body, give me your address. And so I couldn't think because my brain was overloaded, right? So these are the things.
Oh, yeah.
Yeah. So these are the things that happen in the brain as a result of trauma. But we know that using EMDR and using somatic therapies can release the way trauma is stored in the body, and you can actually reverse those changes so that the hippocampus goes back to its normal size, so the amygdala goes back to its normal size, so the prefrontal cortex can get back up online and working properly again with the right amount of neuronal activity. So you can actually change the physical structure and function of your brain by doing these therapies, by practicing EMDR, by reversing the way that trauma is stored in your brain.
Is that why people sometimes don't remember their childhood, is because of what happens in their brain? And that, like, some people say, I don't remember my child. Like, I remember, and other people don't remember at all.
Absolutely. And that's an adaptive mechanism, right? We have dissociation, derealization, depersonalization, all is a way of preventing our brain from being on overload when we have a trauma. And so trauma memories are often stored in fragments, right? So a lot of what I do in therapy, when I start processing with someone, I might say to them, how did you get home after the assault? And they might say, I don't know. All I remember was his face, or I remember being hurt. I don't remember. And as we start processing, oh yeah, I walked home without shoes on. I remember now. Like, they'll remember the trauma as you start processing, because those memories were stored in fragments. I work with a lot of military, and combat memories are often stored in fragments. We often don't remember, how did it end? How did you get home? How did you get back to base after the shooting? How did you get back to base after the bombing? They don't remember, but you put EMDR to it, and then what happens is we start to form a cohesive memory with a beginning, a middle, and an end. It's fascinating. Yeah. You don't necessarily have to remember a trauma in order to heal from it.
Right. I think you do. But that's good to know, because some people, that's a big thing that people get afraid of, is I have to relive everything. I have to relive everything.
Right.
And in EMDR, yeah, you do kind of, I mean, I guess you do kind of relive it, but it's under a very structured environment that is, for me, it wasn't scary at all.
Right.
I wasn't scared at all.
Exactly. For those people that say to me, I know I have childhood trauma, but I don't want to remember it, what I always do is start with I'll say, okay, don't think about the memory then, or lack of memory. Notice what you're feeling in your body. What do you feel? I
Mm,
feel anger. Okay. Where do you notice the anger? I notice it in my chest. Okay. Go with that. And we start,
yeah,
yes, yes, yes. And we start processing from there. So you don't have to necessarily remember the trauma to heal from it.
that's
I
amazing. That
know.
is honestly,
I know.
because that's one of the, I know that's, I have heard people say, I don't want to even go there.
Right.
I'm not willing to go to therapy. I'm not ready to go to therapy and relive my past.
Exactly. And when people say that, that can be unfortunate, because then when you push down a memory, you're developing maladaptive ways of coping with it. You might numb out
Yep.
with drugs or alcohol or sex. You might numb out your brain that way, or you might avoid by playing video games or engaging in a lot of scrolling on social media. We develop ways to avoid the trauma. So I always say, get into EMDR therapy immediately after the trauma.
Hmm.
Even if it's the next day, even if you're still feeling flooded and emotionally dysregulated, start the process, because once you let it settle, your brain starts to store those memories in ways that can be maladaptive.
Right. Because, when you're a child and you're being abused, it's very confusing, right? It's very confusing for adults. Like, we cannot wrap our head around people being abusive.
Right,
But, as a child, you know something's off, but you don't know quite what.
right,
Something happens to you and you find a coping mechanism for that moment and for that
right,
situation. And when it works in that situation, your little brain, when you're a little girl, goes, okay, that worked. I got to remember that next time.
right,
Right. And for me, I carried so much of that into my adult life because I didn't have anybody correcting me. I didn't have anybody saying, no, 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 honey, that's not how we do it.
right,
We need to do it like this. And so, I had to live with shame for years for my behavior of things that I did. And I mean, I could have done much, much
mhm,
worse. I'm not saying I was an awful, awful person, but there's things that I did. And for years I carried, like I said, a lot of shame and guilt about it. And I just, the day I realized I did all that because I was in survival
right,
mode, 100% in survival
mhm,
mode, I learned to forgive myself, because that's exactly what I was in. I didn't know how to handle things differently. And when I was in survival mode, I'm sure my anxiety was like right here all the time.
right,
And then if something negative happens, the ceiling is not very far away for me to hit it because I'm already, at my peak.
exactly,
And my reaction
right,
is horrible and I have to do cleanup.
right, right. Part of your brain is always lit up when you're
Yes.
hypervigilant, and it's a tiny part of the brain next to the amygdala. It's got a weird name. It's called the periaqueductal gray, which is just kind of a long
Wow.
weird name. But the periaqueductal gray, I always tell people, when it's activated, you become like a TSA agent, which means everyone in front of you is a terrorist until proven otherwise, right? And so
Yes.
everyone has to go through security before you'll even let down your guard. So when you go through EMDR therapy, you can calm that periaqueductal gray so it's back to normal size. And so you can let down your guard, you can learn to trust again, you can feel like you're not hypervigilant or walking on eggshells. Yeah.
Yes. Oh, yeah. Always walking, like waiting for the next shoe to drop, waiting for something to happen. Just looking. I mean, I lived my life for like 50 years,
Oh,
probably.
wow.
Maybe not that long, but I mean, I'm 60. So
Right.
let's even just say 40 years I lived. Like, when I think back on it, it was such a part of my life that everywhere I walked, every room I walked into, everything I did, I was assessing. I was assessing.
Yeah.
I was checking it out. I
Right.
was, you know, hyper vigilant all the time.
Yes.
And and I wouldn't deal with it because I kept myself busy.
Oh, absolutely. Yes, I agree. I hear that a lot from trauma survivors. People that have ADHD and people that have trauma tell
Yeah.
me, I can't meditate. And if I say, you can't meditate, really? Okay,
Yeah.
tell me about that. Because if you can't quiet your mind, then a lot of times we have people say that because if they quiet their mind, they have to think about the trauma, or they have to stop for a
Yep.
moment and they feel vulnerable. So if they're busy doing something all the time, they don't have to think about it. So part of my work with individuals then is teaching them to quiet their mind and teaching them emotional regulation and being okay with your breathing and being okay with moments of silence.
Mm. Yeah. 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 Not always having to fill the air with noise or with
Right.
words or, And you just touched on something, and this is another area I've been researching, and maybe you'll know something about this, but what about, I have seen research that the symptoms and the behaviors of ADHD and the symptoms and behaviors of trauma, people with trauma, there's some crossovers that behavior that is the same, like not being able to sit still.
Right.
I can't remember all of them. There was like about 5 or 6 I saw on this sample
Right.
of,
Mhm.
you could say, oh yeah, this person has ADHD, or you could say, oh no, they've got trauma, but they cross over. And it made me think of how many children
Right.
are suffering from trauma and being diagnosed with
I
ADHD.
agree. I agree. And that comes from that part of the brain, the prefrontal cortex, being a little bit offline, right, in trauma. Because,
Right.
right. And so it looks like problems with attention and concentration, problems with impulsivity, all those things that we would associate with ADHD, right? It's like me saying, I don't know my address. I don't know if I ever had one, right?
Mm-hmm.
Total blip.
Mm-hmm.
You might mistake that for a blip in memory, but no, that was a problem with trauma. That was an over
Right.
flooding at the moment, over flooded brain that couldn't see through. So yeah, there is a lot of crossover in the behaviors, and same with head injuries. When people have a head injury, they say, oh, I can't remember, I have ADHD now. No, you don't. You have problems with attention and concentration due to head injury, or you have problems with attention and
Mm-hmm.
concentration due to trauma, but it's different than ADHD. But we often treat it the same.
Right.
We treat it the same. We provide structure, routine, and consistency in the environment. Even an ADHD medication can help with focus and concentration. Mm-hmm. If a person's got a head injury or trauma or ADHD, we can use some psychotropic medications to increase that level of focus and concentration.
Right, right. Bring balance back into their brain. Because
Right.
I mean, I just imagine it's kind of like things are out of balance, and we've got to do things to bring our brain back in balance.
Absolutely.
I mean, we're learning, I think now, right now, we're just learning so much more about trauma. It seems like they started dipping into it, and now they're realizing, oh, this is way bigger than we realized,
Right.
and learning more about it. Do you think that there's more awareness going out there about children who might have trauma that are being diagnosed with ADHD? Because there's so many. My son was diagnosed with ADHD.
Right. I agree. I think there very well could be. I do know that it is easier now for parents, teachers, and educators. Well, I'm not sure about parents, but educators to recognize trauma because they're taught in the school system now better than they were
Right.
decades ago. How to pick up and how to recognize the signs of abuse and to recognize the signs of trauma. We have more people skilled at reporting now childhood
Mm-hmm.
trauma than we have before. Authorities reporting, medical
Yeah.
professional, healthcare workers, teachers have more education and training now than they did decades ago
Yeah.
in recognizing and reporting. But yeah, the
Right.
instances are so high, and if left untreated, trauma can really change our relationships. It can change our view of ourselves. It can change our career path. It can change, yeah,
Mm-hmm.
a lot of things that life could take a different trajectory if the trauma were treated at a young age.
Right. Yeah, I know. I think about that, and that's why, that's what's really pushed me to get this podcast out there, is to get the help out there and get
Right.
the awareness out there.
Right.
Because right now it's still kind of disjointed. There's not like a place, there's not an outline. There's not, okay,
Right.
this is trauma, and this is how it's still kind of all over the
Right.
place. And so I would love to see, more awareness and more education.
Right.
And that's why I have, experts like you on that.
Right.
Get the truth out there, get what's really, because there is so much out there about narcissists, and I've seen stuff that I'm like, okay, yeah, I bet that's true, and then others like, that's
Right.
it's a word that's just thrown around anymore,
Yes, it is. Right.
and that's the thing in my podcast too. I'm trying to, define these words, because we do throw them around a lot. Overthinking
Right.
and, trauma. Well, what is that? What is that exactly?
Right.
Make sure we're all on the same page.
Exactly. And what is traumatizing to one person might only be mildly disturbing to another, right? I hear people say, oh, my divorce was so traumatizing. Okay. It might have been. To someone else, it might just be unfortunate. right? So
Mm-hmm.
different events can be viewed different ways, but that is the definition of trauma. If you feel a threat to life or safety, if the event is
Mm-hmm.
disturbing to you, it's traumatic. It's not was a certain event, right? Some people would interpret war, being in a war zone, as traumatic. Other
Right.
people would say, no,
Right.
no, I did what I did. You put me in front of the threat and I worked appropriately, and I got out of it. I'm safe. That's not traumatic. It's all our perception. Whether an event is
Mm-hmm.
traumatizing to us or not is our perception of events.
Yeah, and it was interesting when I for 8 years I helped co-facilitate a childhood abuse healing workshop for women. It was
Oh,
amazing.
wow.
It was really cool. And I had a friend, she was going to take it. She was actually going, bringing her friend, and she was going to come along and support her friend.
Mm-hmm.
And I knew my friend's background, but I don't tell people, oh, you were abused. They need to come to that conclusion themselves. It's not for me to tell anybody what's going on with them. But she said something so funny. She goes, yeah, I'm coming with whatever her name was, Susan, and I'm going to support her because, I had alcoholic parents, but I wasn't abused.
Oh, right.
And I was like, um, let me read to you the definition of abuse.
Right.
And, you know,
Right.
I said, your parents could have been a blast when they were, drinking, but they couldn't meet all your needs.
Exactly.
So,
Right.
but it's true. I mean, that's interesting because people do throw that word trauma around real easily too.
Right.
And oh, that just traumatized me. And, it's, I think we're just scratching the surface on all this, really.
Right.
I mean, don't you think? I mean, we do know a lot more than we used to, but I think there's still a lot more that we're going to learn about the effects of
Right.
trauma.
We're learning more and more all the time about the neuropsychology and neurobiology of trauma, how it affects the brain, how to release trauma from the body. Different therapies are coming out, especially somatic therapies that teach us how to release trauma from the body. So I think we are learning more and more. And I think that's really, really
Yeah.
helpful, to the population. And I think that it's really, really helpful for people to come forward then when they do suffer from trauma and connect either with a good therapist or a supportive group of others or both, because we can't heal as easily in isolation. We heal
No.
most quickly through our connection to others, right? And so when we have a supportive network, then we can heal most quickly. And especially with narcissistic abuse, because with the element of gaslighting, it's often victims say, well, I don't know if I'm being abused, but if you have a sounding board, another person that can say to you, hey, no, I hear what you're saying, and you did see it right, he is gaslighting you, you
Mm-hmm.
did see it right, it really helps to have a network of supportive others and to have a good self-care routine. I'm a big fan of meditation and visualization and affirmations and thought
Mm-hmm.
conditioning, right? That was my own journey through healing, involved a lot of that, and involved a lot of really, really practicing self-love and turning
Mm-hmm.
that around, because I had such a significant trauma history. I had two people very close to me
Mm.
commit suicide, and I witnessed both of those events. And then after that, I witnessed them. I had a partner who woke me up in the middle of the night and said, Suze, my brain's not right. My brain's not right. And he put a gun in his mouth and shot himself. And so I was present when it happened. So I really went through a bad period after that where I was getting my residency in neuropsychology, and I had a big financial crisis then when he shot himself, and I ended up homeless, living in my car trying to get through my residency, and I had a falling out with my parents who filed a lawsuit against me. So I was just traumatized in the middle of a lawsuit, living in my car, and lived in anger for 5 years. I really lived in a deep,
Mm-hmm.
deep place of anger, and then developed cancer. And I remember thinking, oh, I created cancer in my body because I've lived in anger for 5 years, right? So my
Mm-hmm.
doctor said to me, we did two biopsies and ran a number of tests, and I got a second opinion. And he said to me, you need surgery in 10 days. So he scheduled the surgery. And in those 10 days, I underwent an intense program of meditation, visualization, self-love. And I felt this enormous shift. And when I went in for surgery on the 10th day, my doctor removed a tumor. He removed a lot of tissue, and it came back from the lab negative. And he said to me,
I knew you were going to say that.
he said to me, I have no explanation. He said, I have no explanation for how you had cancer cells here, 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 and here, and now you have none. And for me,
it makes me want to cry.
Yeah, for me, it was, so that's why I became a trauma therapist, really, because I feel like I really get it when people say, I'm traumatized, I'm angry, I can't think straight, and they don't know how to get out of it. I know that processing the trauma with EMDR therapy and then really embracing self-love and letting go of anger and letting go of judgment and blame creates that shift. For me, it saved my life, really. It saved my life, potentially. And it created this huge shift where now I understand that we can choose our thoughts. We're not subjected to the negative thought patterns that run through our brain all the time with anger and fear and anger and fear, because that creates illness. It creates pain and loss and lack. And when we can change anger into love, we can heal anything. We can change our physical brain structure. We can potentially create health in our bodies where we had illness. And so that's kind of been my mission then, to help people heal from trauma, condition their thoughts, rewire their brains so that they can live in light and love. And my story is as dramatic and traumatic as it is. It was for me the catalyst that led me to the work that I do now. And that's why I've created courses and I've created programs and I've created ebooks and in guided meditations and hypnosis audios, because I really think that if we consciously choose our thoughts and we put ourselves in that place of self-love and healing, that we can overcome even the darkest of traumas.
That's where the hope is, that we really can. I mean, you're a walking testament of that. I'm a walking testament. I mean, my life is very different, and it is, I always want to put that hope out there. And that was the number one reason why I created this podcast, was to help shorten people's pain.
Right.
Right. And that's exactly what you're doing. That's exactly what you're doing. And I know for me, I started my healing journey at 19. I'm now 60. So it's been a long journey, but really the majority of my healing has happened over the last 13 years. That's where the majority of it has happened. But there is definite hope. And I love what you're doing. Thank you so much for being here and sharing.
Thank you.
And I'm gonna ask you a question. Then I'm gonna have you. You don't have to list everything, because you offer so many free things. It's wonderful. And I've got some here, and we're gonna list them all out. I mean, she's got a lot of free stuff, and I'll let you explain that. But let's start here. What do you want to leave our listeners with?
Oh, I would like to leave your listeners with the knowledge and the understanding that it does take strength to reach out for help when you're hurting, but it is very, very, very worthwhile. I always say we're not responsible for what's happened to us, but we are responsible for our own healing. And I think that taking that first step can feel difficult. But as a psychologist, I firmly believe in the innate ability of humans to grow and to change and to achieve healing.
How can our listeners reach out to you? Because I know you've got a website, and then again, you've got a lot of resources on there too that are great.
Right. I have a couple different sites. The one where all my free resources are listed is dr-spicer.com. So it's dr-spicer.com. That's where I have free affirmation audios. I have some free ebooks on there, some guided meditations. And then my website, www.drsusanspicer.com, is a great way to connect with me too. My email is listed on there. My phone number is on there. So if anyone wants to make an appointment, they can reach me through that site, through www.drsusanspicer.com.
Okay. And then you have here the Narcissistic Abuse Survival Toolkit.
Yes.
Is that also where they can take that test? And that's on your dr-spicer.com.
Yes, absolutely.
Website.
Yep. That quiz is part of the toolkit, but it's also listed for free on that site. It's free. That quiz is free. So the Narcissistic Abuse Survival Toolkit is a really, really comprehensive resource that I created last year. It's about 3.5 hours of audio and 200 or 300 pages of my writing. And there's a survival guide. There's a workbook. There's a really great meditation about how to heal a trauma bond.
Ooh.
Yeah, it's really, really lovely. And then I have another guided meditation about overcoming narcissistic abuse. I have lists of resources. It's a really thorough, comprehensive resource, and that's listed.
Yeah.
That is for sale at the top of that site.
Okay.
Dr-Spicer.
Okay, good.
Yeah.
Excellent. Well, this has been fantastic, and I know I've learned. I actually learned a few things about narcissists that
Nice.
I mean, I didn't even think about the spectrum, but it makes sense.
Yeah.
You know, because
Right.
it's been really informative.
Yeah. Thank you.
I love it.
Yeah.
Well, thank you, and I appreciate it, and yeah, it's been great.
Thank you so much. I'm grateful for the opportunity to be here. I'm really grateful. Thank you.
Yeah, well, we're both doing the same thing, beauty from ashes, right?
Exactly.
Our life is beauty from ashes.
Yes.